October is National Substance Prevention Month, so we are taking a moment to shed some light on the impact that drug and alcohol abuse has on families and communities.
And right now we are joined by the Director of Behavioral Health Programs and Innovation at Highmark. We have Dimitrios Maroussis here. And Dimitrios, substance use disorders are more common than we think. There are so many families going through this right now, either a loved one or themselves.
That's true, yeah. So in the United States, over the age of 12, 17% of Americans have a substance abuse problem.
Wow.
And only 6% are pursuing care.
Only 6% of that group is pursuing
and those
care.
are the ones we know.
Right.
Let's talk a little bit about the stigma, because that's obviously something that people want to take away, because that's maybe one of the reasons why people aren't getting help. This is a medical condition. This is not like people confuse it with some sort of moral failing. That's not what it is.
Oh, it's absolutely not what it is. It is absolutely a medical condition. There are medications to treat it. There are, evidence-based practices to help somebody attain recovery. And it is not a moral failing. It's not something you can try harder at and do independently.
And when you're looking at these statistics and starting at the age of 12, when we're thinking about a 12-year-old using, oftentimes there's either a mental health issue or some sort of severe trauma that has happened with these individuals that has led down this road of substance abuse.
Well, it's not uncommon to also have a mental health condition, which complicates the treatment.
Right.
So it's not uncommon to get treatment for your substance use disorder as well as for your mental health issues.
Like a dual diagnosis, right?
Right.
Yeah.
Let's talk about some of the treatment and some of the approaches that you all have taken, because you've actually seen a decrease in overdoses because of this. So it is working, right? Right.
So, once again, some of the use problems have significant mortality risks, such as opiates and alcohol use. And we've seen drops nationally in overdose mortality rates. We'd like to think we are contributing to that by equipping our providers, by reducing barriers to accessing care, by working with our providers in order to assure that they're delivering evidence-based care.
I think one of the hardest things too is, if somebody is ready for help, if they finally get to that point, sometimes it can be that scary first step and where to turn to. What are you all offering to help in that?
Well, so once again, as Highmark, our Highmark membership has access to their benefits.
Right.
So they can call us. They can ask to be connected to a case manager. We have a strong partnership with Spring Health.
Right.
And Spring Health has done some dramatic things for us by increasing our network by 40% this past year. By able to provide appointments within 2 days of a request, by being available 24/7 for triage. What do I need? Because not everybody knows. Today might be the day I want to start care, but they don't know where to start. They don't know what do they need.
Right.
And so Spring Health can be an option for that portion of our membership that has access to that to start their care journey.
If someone's watching this and they know someone, a loved one, that they want to try to help, what advice would you give? How can you get that person to want to help themselves, I guess?
That's quite tricky. So you have to, you have to work with them. You have to work so you can continue the conversation. You have to work with them so you're not alienating them, creating that sort of space of judgment that pushes them away.
Right.
The ideal is to keep them close, keep them engaged. They may not be ready today, but because of the rapport, because of the relationship, they may choose tomorrow. They may choose the day after.
Thank you so much for that.
Yeah, such an important topic. And we have links to so many resources that can really help in our area. It's all on our website at pittsburghtodaylive.com.
And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.